The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone, and welcome to our LeadingAge Michigan Safe and Calm webinar. It's Friday, and it's been a really very busy week in terms of policy and discussion. At this point, the department continues to issue new guidance now and then, but mostly often they continue to tweak policy and provide clarifications and discussion. So in reality, it almost seems harder to track than when we were getting new guidance every other day. So it's been a little bit challenging lately to keep on top of it. We're sure it's been difficult for you. One announcement before we do get started is that a reminder that there's no webinar next week on Wednesday, and that is because of our Serving with Grace celebration. And Blake will tell you a little bit more about that later. We wish everyone would attend. We need to acknowledge our frontline workers and our other leaders as well, who have provided amazing service over the past year and throughout their life, many of them. So our next webinar is scheduled for December 11 at 11 a.m. Another upfront announcement I want to make is about vaccinations. We do know that vaccines are coming very shortly. There is a huge amount of guidance about that. And in fact, the department just put out a whole web page about it. We've not had time to digest it all. So our suggestion is that if you have questions about it, please shoot them to me separately. I'm not sure that the department, I know that the department has not been able to answer many of our questions yet to date, although they have some. So we feel like it's still in progress. So we, even though we do have some resources here in web pages and guidance for you to review, we would like to hold the majority of that discussion until next week. So for today, also for today, we have added some member polling to this week's agenda. And we've done that so that we can better understand how things are going out there. Off and on, we do note, and we always know, that there's a lot of dialogue and discussion going back and forth between us and our members, and us and policymakers, and our members and surveyors. But just like you, we are always analyzing several sources of guidance to figure out what the rules are, and also what the best practices are. But we also have to depend on help from you all to get a sense of the real experience out in the field, especially for nursing homes and their surveyors, what's going on in the survey world. Sometimes we're looking at a rule, but the surveyors may or may not be interpreting it the same way. And then after the polling, the rest of today's agenda is pretty much routine. So as usual, we will start with an advocacy update from Dalton Herbal, our Director for Public Policy.
Good morning, everyone. This week has been kind of a whirlwind in Lansing here. And today we'll be covering some of the things I mentioned on Wednesday's call in a little bit more detail. And then also just kind of covering what bills have been moving and the governor's newly proposed, as of this morning, COVID supplemental budget for next year. For our first topic, we'll be just covering what our call with State Budget Director Klob was like. I had mentioned it on Wednesday's call and wanted to give you some detail about that. The primary thing or topic of the call was about next year's budget process and what they're expecting the starting point to be. As you can see on the slide, Director Klob in the Executive Budget Office is projecting a $1.4 billion deficit for FY 2021. To put this into context, last year's budget deficit that they had to put together and make up was $900 million, and that was kind of resolved through a series of spending freezes and hiring freezes, then funding cuts and funding redistributions from government programs, and a large portion of it was backfilled by federal relief dollars. The legislature itself, they haven't published anything yet, but our sources are saying that they're projecting slightly lower than 1.4 billion, probably about 1.1 billion. So they're $300 million ish apart right now. We'll see where that goes. They'll have the formal estimates out at the start of the new year, because the budget process itself will start early February, probably that first week of February, is when you'll see the recommendation come out. The director did also want to note that the governor's office is pushing hard for a federal COVID relief funding package to be passed, and you will have seen that if you have been following her statements or read her letter to federal policymakers that she wrote requesting more federal relief, not only for Americans in general, but also to help the states meet their budget deficits, because she likes to say it's not a Michigan issue, it's a 50-state issue. So this is a national issue that I think a lot of people will be facing. Also this morning, if we move to the next slide, please, the governor proposed a COVID supplemental for the next fiscal year. This supplemental itself is a $300 million general fund supplemental. The actual supplemental itself is larger, but the $300 million general fund number is really kind of the funds that they can debate about between her and the legislature. So in our world, our funding comes from the general fund, so we're worried about the general fund dollars in the supplemental. This is not the budget. This is a separate budget document itself. This is an extra spending document, think of it that way. But the primary purpose of this $300 million supplemental is to continue some of the state's COVID response programs after the December 31st deadline. These $300 million right now would be state funds, but it would be backfilled with federal dollars if a federal COVID relief package was passed that allowed them to do so. This $300 million package is separate from the $100 million small business package you may have heard about. So really she's requesting $400 million in state general funds for the next year to kind of keep the COVID stimulus and COVID response going at its current rate. Some of the highlights of this thing, it's very generally written. It's not very prescriptive. So the highlights themselves are also general. And in fact, the DHHS portion, which is where a large amount of our funding comes from, is very general. And this is almost word for word what is in there in its entirety. DHHS itself receives about $192 million-ish to continue their COVID-19 response efforts. There's 5 main focuses that it says that these funds will all have to support. And so these are the continuation of the testing and contract tracing plan, the purchase of PPE and vaccination supplies, supporting currently employed staff in the department's public health administration and at state employees at state hospitals and state healthcare centers. Also supporting healthcare and human services providers throughout Michigan, including hospitals, nursing facilities, direct care providers, child placing agencies, foster care agencies, and the establishment of a sufficient healthcare capacity system to manage the administration of the vaccine itself. The 2 specific call outs in this budget that are outside of that $192 million, there's about $6 million for local health departments so that they can be ready to support the vaccine distribution and immunization activities. And there's also $2.9 million to prevent and respond to COVID-19 infections at state veterans homes, and to continue to fund the National Guard activities and their actions related to coronavirus activities and responses. On last week's call, I mentioned that the electronic monitoring bill was up in committee. They had that committee meeting. It did not pass that committee meeting, but it is likely to be up next week in the House Health and Human Services Committee. It's important to note that this bill is not a law yet. It has to move and be passed from that House Health and Services Committee to the House Ways and Means Committee, and then passed out of there to the chamber, which then would have to take a vote, and then it would have to be signed by the governor. So it's still got a lot of steps to go through. And last week, they didn't have the votes to pass this out of the Health Policy Committee, but we are watching this bill closely. And we do anticipate them to have the bill up in committee next week. Whether they take a vote on it or not, we'll see. Right now, they don't have the votes to pass the bill as of yesterday. They also have a substitution for the original bill in place, but it's not really super widely distributed, but I have attached it to this webinar in the handout section. You'll see one that says SB 77H2 draft. If you're interested in reading the actual bill itself, that is it right there. That's what they're considering right now. You won't find that out there on the public websites, but it is public information. So feel free to access that if you have any specific questions. But in general, this bill would allow a resident to set up an electronic recording device in their room at their own expense in a SNF. They must notify the SNF in writing. They must get permission from any roommate or roommates. They have the ability to request that it be turned off, blocked, or removed at any time, or turned off. And they can work with a SNF to care plan the use of the device if they so wish, or form a different kind of a plan outside of the care plan if that's how the SNF wants to implement it. You do have some leeway in the implementation of the devices. Also, I did mention last week that next legislative cycle, they will be considering a bill similar to this one for HFAs and AFCs. And if this one doesn't pass this time, I believe it'll be brought back up next year. So we are forming a work group. If you are interested or know of anyone who might be interested in joining a work group on electronic monitoring in general, please send me an email. It's right there on the bottom of the slide. I did get some responses from last week, so thank you. And we'll have an article in the newsletter about it as well. Some other bills that are moving and introduced right now. There's, as I said, a lot going on here. And we mentioned some of these last week in kind of generalities, but now they have bill numbers, and I linked it here so you can read the bill if you want. I won't go through these, but just know that they are largely focused on alleviating some workforce pressures and kind of establishing some of the executive orders around staffing and allowing volunteers to do certain things, and codifying the use of COVID hours as continuing education requirements. If you do have any questions, please feel free to email me, but if you want specific information, it's right there. Lastly, our important date slide. It hasn't changed since Wednesday. I will just highlight again that 12/15 is the deadline for CRC, CR, or CRF applications. So please continue to work on those if you are working on them.
Hey, Deanna, before we move to the next section, I just had a couple questions for Dalton. Do you mind if I ask those real fast?
Sure, but let me make a comment first.
Okay.
Also, and then you can ask questions. But I do want to call out the fact that an awful lot of those bills that Dalton was just referencing have to do with those flexibilities that were allowed to providers under early executive orders. And we noted that some of them were rescinded, and we have been arguing throughout the course of the pandemic to reinstate those. So the department has not really done that, and yet at least it looks like the legislature is finally moving on those pieces. So this is really a very positive thing. It allows the providers to go back and continue some of those flexibilities that were so helpful, especially considering the staffing challenges that we have now. So I just wanted to say that before we move over. Go ahead and do some questions.
Okay. You mentioned a few weeks back that the electronic monitoring bill would be in lame duck. Do you feel this will pass before end of the year, or is it more likely it will be picked up again next year?
So right now, as it stands, they don't have the votes to pass this out of that first committee. And I was reading off the process there a little bit, and it's got a long way to go before the end of the year. So personally, I think it may move out of this committee, but I don't see this making its way all the way through the process, then to the governor, and then having her sign it. There have been some historical groups that have not weighed in on this bill that largely oppose this kind of a legislation. They haven't weighed in this time around. The bill's still early in the process, so they may come to the table, but I don't see this getting done during this legislative session, but it will certainly be a continued topic of conversation in the next legislative cycle, especially as the bill sponsor continues to add levels of care to the electronic monitoring idea and slate at the state level.
Okay. Is the list of other HB part of the lame duck and will need to be passed or recreated next year?
Yes, so everything I listed right now is part of lame duck. Those bills, I would say, are likely to pass. I know the legislature itself has been focused on those bills, and the reason they introduced those bills is to get something done because they believe that these were actually positive executive orders. You have to remember that in Michigan, our legislature is controlled by Republicans and our governor is a Democrat. So anytime you see them working together or introducing something similar to one another, it's a positive sign for the bill moving through the process. So those are included in lame duck, and I do see them getting passed before the 31st.
All right, and then the last question here. Any news as to if the $2 bonus for direct caregivers will be extended beyond December 31?
So the intent of that $192 million in the governor's supplemental is to extend that program and extend a number of programs. $192 million is not a lot of money for that program. I think it was initially established with like a $201 million supplemental. So I know the $192 million is to extend that program. Right now, it's a little early in the process to know what's going on. I think the governor just wants to get some stuff out there to say, hey, we're working on stuff. We have Michigan's best interest at heart. We really would like the federal government to come through and supply Michiganders with some more funds. And I know that also House Speaker Chatfield has also expressed his intention to extend that program. So I would see in the future, if I had a crystal ball here, that program does get extended, but the specifics or how much or for how long are not out there right now.
All right, it looks like that was the last question, so we can go ahead and move on.
Thank you.
Deanna?
Hi, sorry, I was on mute.
No, you're good.
So for today, we have updated our daily tracking slides as usual so that we can track caseload changes, especially during the surge here. And we've also included some other updates that were published by MDHHS. And these are data graphics that are pretty much created by the University of Michigan and talks a lot about long-term care and seniors. So moving on to the next slide. This first slide, though, is an update of data from about long-term care facilities nationwide, published by the Kaiser Family Foundation. You can see by late November, long-term care facilities have seen over 100,000 now resident deaths over the entire course of the pandemic. And as part of the narrative that came along with this graphic, you can see the number of states where deaths in facilities were a large proportion of all COVID-related deaths in those states. And there are a lot of states that where the long-term care facility deaths are a large proportion of all their deaths. But fortunately, Michigan is not in that number. Most importantly, and I thought this was a little disconcerting, but also interesting, the authors ask if nursing homes and other long-term care facilities are able to protect their residents. And if not, indeed, what should be done? And they just, left it there. Of course, they don't have an answer for that, as we don't either. We know that some can. And we know that some other providers are struggling. And this reality is looming over us as the department is considering how to address COVID residents in some of our AFCs. They have put together a work group at the state level, but they haven't completed their planning yet, and we are attending those meetings. But we do understand, and the state understands, that a lot of these facilities have significant challenges. So we noted on Wednesday that the number of new cases was declining a bit, although we have seen another small spike again since then. It's only been 2 days, but we do see the numbers going up again. We're going to be looking very closely at the numbers through early next week because the governor's next actions will be dependent on them. And the next week or so is when they expect to see the Thanksgiving surge begin. So we are watching this closely. And unfortunately, we do have to note that deaths are continuing to climb as well, as you can see on the graphic there. The CMS positivity rates were updated on Tuesday. Right now in Michigan, there were still 58 counties out of the 83 with a 10% or higher positivity rate. That's pretty high, although I think it was higher a couple weeks ago. 21 counties were listed in the 5 to 10% range, and only 4 had positivity rates less than 5%. As a reminder here, we've restated the rules that nursing facility members have to follow. They should be monitoring this data every 2 weeks. If the rate goes up in a way that increases the testing requirements, you have to institute that immediately. But if it goes down, you have to monitor that for 2 weeks to make sure it stays down before adjusting your testing downward. And that's just a reminder, that's not new. So here are some of the trends that the University of Michigan researchers have published on the MDHHS COVID webpage. The amount of states with increasing trends is diminishing. So even though there's a surge, the number of states that have increased numbers over the past week or so is diminishing. Rates in 25 states, though, have continued to rise. And most states, even though not as many have rising numbers, they still have very high rates of transmission right now. Of the Midwest states, while hospitalizations are high, it does look a little bit better for Michigan, where it seems to be flattening a bit. And specifically in Michigan, while increases have flattened overall a bit in terms of caseload, they don't anticipate that that will continue. In fact, the U of M researchers came out and said that people cannot plan on this flattening for very long. They do believe that the surge will increase through December and actually into January because of holiday behaviors. They also noted that 9% of all recent deaths were under the age of 60. So there still are issues for younger persons as well. ER visits for COVID have risen since September, but ICU hospitalization, at least right now, along with other hospitalizations in Michigan, seem to be plateauing. This is another U of M slide, and on the right side is U of M data for about the past month. And you can see the greatest proportion of deaths continue to be within the senior population. On the other side of the slide, on the left side, since July, you can see the deaths per million is very high in the 80 plus category. And note that this is still only Michigan data. And now and then, U of M reports the case numbers related to the governor's actions. We've included that slide here for you because they recently updated that. And this is just for your review. They do find, you know, there are definitely a positive correlation between the mandates that she puts into place and the responses in terms of caseload and deaths, obviously. So as we said earlier this morning, we're going to be doing some polling today so that we can be well informed in our discussions with the state and other policymakers. Before we start, we do want to let you know that there are multiple persons on the webinar that are sometimes from the same organization or the same facility. And don't worry about that. Go ahead and answer the questions. We have the ability to sort that out later in terms of numbers. So we're going to start with testing. The first question is for nursing homes only. Are you using point of care tests primarily? And have you been able to get enough test kits from the state in advance? We know of at least one member who has been having trouble getting test kits. So we also ask that you identify in the comment box any special experiences or comments that you might want to make about any of the questions as we move forward. And then following that question, we're going to ask the same thing for AFCs and HFAs. But we're going to start with nursing homes only. And so Blake, I'll turn it over to you.
All right, I'm going to go ahead and launch that poll right now. We'll give that about 30, 45 seconds, something like that. So this is multiple answers, so you can choose as many as you need. All right, looks like we've been about the same percentage for a little bit here, so I'm going to go ahead and close that, and then we can show those results.
Okay, well, that's very interesting. I would have thought that more were using point of care tests primarily. Are there any comments about this?
I do not have any.
Okay.
All right, so we will move.
All right.
Oh.
Go ahead.
All right, so we will move on, excuse me, to the second question here. Again, this is multiple choice, so feel free to choose as many as you want, and we'll wait about 45 seconds here again. All right, before I close this one, we did have a comment come in, and someone said that my comment is we are hoping to switch to POC, but we need to complete our trainings first.
Okay, good, thanks.
They also said they had to wait for their CLIA waiver also.
Right.
All right, so we'll go ahead and close, and we will share this one.
I'm kind of surprised that so many are still using PCR testing. So that's something that we can probably talk to members about going forward. But interesting. Thank you.
All right.
All right, this next piece is about PPE. Both of these next two questions are for nursing homes only. In general, we're wondering how the supplies of PPE are holding up. Do you have at least a 3-week supply overall? And the issue of N95 mask usage has come up a lot in the last week. So we would like to know how members are using them. The second set of questions is about surveyor practice related to the use of N95s and any input you may have had about use of those, that level of protection, and about fit testing. We specifically are asking nursing home members to comment if they can on what surveyors are saying to them about either of these issues if you think it's important. And so remember that these two next questions are just for nursing homes.
All right, so I will go ahead and launch those. And while people are answering this, we did have a couple more comments, so I'll just go over those right now. Someone said, we ordered more tests last week, but have not yet received them.
Okay.
Someone asked, does N95 include KN95?
Yes. Whenever I'm talking about N95, KN95, as long as they're approved by the FDA, would be included.
Okay. And then someone says, we use rapid tests for vendors, clinical contractors, surveyors, and staff. We use PCR for staff and residents, so it is about 50-50. And then same person said, it is the error rate on the POC that keeps people using the PCR test.
Okay, thank you.
All right, so I'll go ahead and close this one. We'll share those results.
Well, that's good. So PPE doesn't appear to be a problem, at least for those who are responding.
All right.
And I think that go back for a moment if you can.
Give me 1 second.
So the N95 mask thing, 50-50. And I think that there's a lot of confusion out there about whether you should or I'm not sure if that's a member choice. We are going to talk about what the department said about that this week in a little bit. But I did want to get an idea of what you all were doing before we did that. So thank you for that input. Okay, Blake, go ahead.
All right, so we'll go ahead and launch this one as well.
So basically, we want to know what you're hearing about from the surveyors about mask usage. If you have had conversations, any conversations about fit testing, and whether or not they're reviewing fit testing for facilities who are using N95.
I'm just going to keep reading the comments while these are up. We are using KN95 for all direct care.
Okay.
Someone said, we also had difficulty obtaining adequate supplies of POC testing supplies. We save a few POC test kits for residential staffs with acute SS.
Okay.
All right, so this one has been up for a little while, so we will go ahead and close this and share the results on that.
So if I'm reading this correctly, about 22% of you are telling us that surveyors are expecting N95 masks for all care when they're available. Okay, that's interesting. Okay, and fit testing for all N95 mask usage, small percentage believe that their surveyors are telling them that, but most are not reviewing for fit testing. Okay, thank you. That's very helpful. All of this information is very helpful to us. So we're going to move on now to HFA and AFCs, and we're going to repeat the same question about PPE. So you'll notice that all of the answer possibilities are the same. And HFAs and AFCs, please respond. Also remember that if you have comments or issues or a situation you want to let us know about, please put that in the chat box.
Here we go. Deanna, shouldn't we be more comfortable using POC testing in a serial way with weekly repeating testing? I thought this was actually now preferred by MDHHS for repeated weekly testing. Am I correct?
Yes. In fact, when you're doing serial testing, both the CDC, CMS, and the state thinks that is the route of choice. You get your response right away. Sure, there's an error rate, but there are also error rates with PCR tests. So I was a bit surprised to see those numbers, and I think that we have to talk about how the PCR tests are working for you. They are a tad bit accurate, that's true. But when you're doing serial testing, pretty much the benefits of the point of care testing is considered by those entities to outweigh the need for PCR tests unless you have to confirm. But we'll probably investigate this a bit further to see whether or not the department has any updated thinking about it. They did change some of the confirmatory test protocols that actually concerned me a little bit. We're going to talk about that a little bit later. But that's my understanding, is that that is the preference. But if members are not using them, we will probably investigate further and figure out what that's about. So, again, HFAs and AFCs pretty much have a good supply of PPE. Some are using masks for all care, and some are using for COVID or observational care. And 8% do not have access to masks at all. Okay, wow, thank you. Okay, so this next set of questions is again for nursing homes only. This is about COVID relief facilities and what your intentions are and your current outbreak status. So the first question is about whether or not you're planning to or have applied to be a retaining only or a retaining and admitting COVID, or that you have not applied at all and don't intend to. And the second part talks about your outbreak response. And I think that's pretty self-evident when the options come on the screen. So Blake, go ahead.
All right, and I'm just going to keep reading comments. We do differentiate between N95 and KN95, as N95 requires fit testing and KN95 does not.
Okay.
We offer N95 to team members who want to use them outside of COVID/PUI.
Okay. This person is under investigation, Blake. Yeah. Okay.
Had survey this week, and fit testing and N95s were not discussed. However, we were all wearing them.
Okay.
And then the last comment I have right now is we haven't had any COVID cases and have not used any N95 masks yet.
Okay. Is that an HFA, AFC, or a nursing home? Do you know?
I do not know.
Okay. Well, if they let you know, we can figure that out later, though.
All right. So this one's been up. I'll go ahead and share the results on that.
Okay. So about 2/3, which is pretty much in alignment with what the state's doing, right? Across the state, about 2/3 of those applying to be a COVID relief facility are retaining only, and about 13% have not applied at all. Okay, great, thank you. Next piece again is about the outbreak response. You can put those that question on the screen, Blake. So whether you're currently under an outbreak, you're not, you've never had an outbreak, but you've had an outbreak and it's been more than about a month ago. Those are the options for nursing homes only.
And then I got to answer to your question. We are an HFA with no COVID cases.
Okay, good, thank you.
All right, we'll give this one about another 15 seconds or so. So make sure to get your vote in, and then we'll share the response for that. All right, so we will go ahead and close that and share this one.
So we were wondering how many of our facilities were actually in the middle of an outbreak, and apparently it's quite a bit. And at this point, no one who at least is listening to the calls have never had an outbreak. and only 6% has been more than 4 weeks. So obviously, everybody's under a lot of concern and stress here over outbreaks.
Someone also
Okay,
said
we can.
outbreak
Go ahead.
outbreak equals 1 resident, yes, from hospital.
1 resident that is facility acquired. If you're taking a positive person, known to be positive, or even who test positive shortly after their admission, that's not an outbreak. So an outbreak implies that there's been some transmission in your facility. And we're asking the same outbreak questions to HFAs and AFCs. Currently under an outbreak, not currently, never had an outbreak, or an outbreak but it's been more than 4 weeks.
All right, looks like we've been sitting at the same, so we'll go ahead and share those results.
Okay, so more of these facilities have never had an outbreak, which is obviously good. But most are still under an outbreak response right now. So again, even though not to the level of nursing homes, there's still a significant number of facilities out there who are under an outbreak response. Okay, so this is our last question, and LeadingAge Michigan is currently working with a lot of stakeholders, members, etc., in very early stages in developing a conversation about mandating vaccines and how realistic it is, how practical it is. We just wanted to get a sense, and someone asked this last week, to monitor, or actually to poll members to see if they had intentions to mandate. So this is a preliminary piece. If at this point, you know, you are planning to mandate, and this is for all providers, not just nursing homes, mandating vaccines or not planning to mandate vaccines. And that will kind of inform our thinking as we work with members and other stakeholders about this.
All right, we'll give this another 10-15 seconds, and then we will close this one up. Okay.
So 55% are still unsure. So that is very telling. And only 5% are planning to mandate vaccines. So that's helpful to inform us as we move forward. Thank you. That actually ends our questions for now. We really appreciate your comments and your responses. They help us understand what's going on out there in our discussions with policy people. So moving on to resource and guidance updates. This first piece, we just wanted to let you know that LeadingAge has developed several communication tools that provide talking points around the pandemic. And we just want to remind members that these are available in the links here on the slide if you want to take a look at them. A lot of media templates if you have to talk to them about any negative narratives included as well. So as I said before earlier today, there is a lot of discussion and material out there right now about vaccines. And while there's a lot of planning going on, a lot of work going on, we still don't have a lot of the answers. We have several questions into the state right now, and we're kind of waiting for some clarifications, particularly about how all the residential settings may be included in the first tier. We did hear from Dr. Caldoun yesterday that they keep specifying nursing homes, and so we want to get that clarified. The CDC has determined, we have heard from them in their recommendations that HUD Section 202 communities will be in their first tier, but they really don't speak to other independent living settings. We heard from LeadingAge that CDC is trying to focus on those who cannot live independently. So we don't know what that means or how that works for persons in independent living settings, although they did focus on the Section 202 communities. So even though a lot of recommendations and guidance are coming out from the CDC, it is the state, Michigan, that will decide how these vaccines are distributed. So we are continuing to ask for clarification about how different provider types are included. Another update from the department, they have developed a provider webpage for vaccination information. We were just alerted to this yesterday. I think it just went up recently. We have yet to review in detail, and the amount of material on this webpage is voluminous. So we plan to focus this topic on our webinar next week, and we'll talk in detail about the vaccine plan to date. Another thing is that the CDC has reported to LeadingAge that the pharmacy partnership program has changed a bit from its original plan. The original plan that it was a direct federal program, that it bypassed the state completely. However, they have clarified that each state will be able to dictate now the priority order for distributions, although CVS and Walgreens will get their vaccine supplies directly. They don't have to go through the state to get them, but they're only going to be able to start distribution after the state directs. So we're not sure whether that means they're going to direct it to nursing homes and then assisted living, or if they're going to pick high priority nursing homes, or we don't know what that priority order means. LeadingAge has let us know what their conversations have been with the CDC. So we're waiting to hear a little bit more about that. Providers who have not signed up yet for this program are going to have to go directly to the state outside of it in order to get any vaccines. Earlier this week, we forwarded the notice of the requirements for vaccine providers and sites to register under MICR in order to administer the vaccine. We did receive a clarification from the state, and facilities who are using the pharmacy partnership program and who are not administering the vaccine themselves will not have to register. However, that's a hard decision to make, because we want to remind everyone that there are only 3 distribution days for a site within that pharmacy program. And as new residents are admitted, and for new staff that may come on board, you might want to be able to provide vaccines later. The state is looking into this as part of the plan. It came up yesterday in conversations, but members should consider registering even if they are using the pharmacy program. We're also working with the state to address the fact that there's a limited number of site visits, 3, only planned by each pharmacy. And last but not least, if you want to review the CDC early release document on vaccine recommendations that came out, I think, yesterday, the link is is on the slide for that as well. There were numerous, there were about 50 CDC updates. Thankfully, most of them did not apply to long-term care yesterday. They have added a frequently asked question page link to the guidance page for point of care testing. We didn't see any new information there. Members might want to review it. The link is here. Sometimes they just tell us when they move things around. There's also a new FAQ on vaccinations, and again, we're going to review that next week when we focus our webinar on that topic. Yesterday, the CDC also issued updated guidance for multifamily housing, and there was a lot of information on this page as well. It came out yesterday afternoon, and we have not had time to review that in detail, but affected providers might want to look at that. And last but not least, on Wednesday, the CDC updated its guidance for quarantining persons who have been exposed to someone with the virus. They do remind everyone that local authorities establish the rules for quarantining, but they're recommending, and overall, the CDC recommends the continuation of a quarantine period of 14 days for anyone who's been in close contact with a positive person. But they also give local authorities the option to end the quarantine on day 10 rather than 14 if no reported symptoms have occurred during daily monitoring. And they say that that change, you have an estimated transmission risk after day 10 of between 1 and 10%. So there's always some risk that, the time frames, which are always general, there's always some risk that they might not work for an individual person. And they estimate that if you use this 10-day quarantine limit, the risk for further transmission right after that is between 1 and 10%. For scenarios where there's testing available, they are giving the option that the quarantine can actually end on day 7 if the test was negative and if the person developed no symptoms during daily monitoring. That testing specimen must have been collected within 48 hours before the time of planned quarantine discontinuation, which would mean around day 5. But no matter what you do, you cannot discontinue that quarantine before day 7, no matter when you test. And the risk for transmission after that 7-day limit for these kinds of persons is between 5 and 12%. And for both scenarios, continued symptom monitoring and masking is required through day 14. This morning, I did see a notice that MDHHS is going to accept this recommendation. I don't have the link for that yet. I saw just this before we came on. So apparently the state is going to move to this option. So we can pause now for a few questions, Blake.
All right, thank you, Deanna. Before we get into any questions, each year LeadingAge Michigan honors individuals and groups who embody excellence in leadership, care, and service innovation, and who have made outstanding contributions to their communities and within the field of long-term services and supports. It is always a time of acknowledgement, celebration, and laughter. This year especially, we point to those who have endured through this difficult time and managed to serve with grace throughout. Join us on Wednesday, December 9th for a free live streaming event at the LeadingAge Michigan Facebook page. Our event will be divided into 2 separate events in order to best accommodate our audience, starting at 3 p.m. with a keynote presentation and a celebration of our Leadership Academy. We will then reconvene at 7 p.m. and will be hosting a celebration and recognition of our award winners for members, colleagues, friends, and family. This year, we will be virtually acknowledging our many award winners, and we will be joined by 2 of Michigan's greatest resources, Monica Levin and Tim Cusack. We are excited to be able to acknowledge our many award winners and celebrate one another as we all do our best during these very challenging times. LeadingAge Michigan would also like to thank our many dedicated business partners who continue to support our members, their staff, and the association in everything we do. So with that, we would like to thank Matthew Garlick over at Omnicare, Andy McLeod at GMB, Therapy Management, along with Kim Murphy and Carrie Hensel, Sheila Ralston over at Creative Dining, and Tom Myers at Ziegler. Together with our sponsors, we know by working together and offering support to one another, we can overcome anything. Please celebrate one another with us. You can go ahead and register or RSVP for this free event right now. All you have to do is head over to the leadingagemi.org website, and you will see this banner right here. As soon as you go to the homepage of our website, you can go ahead and just click on that banner. That will take you to the RSVP registration page. All you have to do is click on register, fill out your information, and you're good to go. We'll make sure you get the link so you can go ahead and join us. Along with that, just a quick reminder again, I know Deanna's touched on it a couple times, but we will not be holding our Safe and Calm webinar next Wednesday. Instead, we'll be having our Serving with Grace event, so please come join us for that. Our next Safe and Calm webinar will be Friday, December 11th at 11 a.m. Eastern Standard Time. So now I will go ahead and pull up the questions. Why can we not get the vaccine like our flu vaccine without needing to register?
I don't have the direct answer to that. I do believe that it's important because this vaccine is going to be approved only under emergency use, that they definitely want to track responses and difficulties with it. I think that's one of the reasons. But you do, in order to administer this vaccine, you're going to have to register under MICR. Other than the reason I said, I'm not aware.
Can we apply the reduced quarantine to residents who have been identified as having possibly having been exposed to a positive staff?
That's a good question. We'll have to work through probably Laura to figure out if this is a nursing home, well, or HFA or AFC. Obviously, they try to coordinate with MDHHS, but it's the surveyors that are really going to be looking closely at this. I'm not sure at this point. We can ask that. Technically, I think that if your policy says you're following CDC guidance, and if the department has approved that, the only thing that I would do before I went down that road is I will do this myself. I'll check the CMS guidance, because if the CMS guidance has those timeframes in it, and I think that it does, if I remember correctly, then you're tied to that. So we'll have to see how this plays out. It's a relatively new, I think it's been out just 2 days, new guidance. We'll have to see what the departments say.
How do CDC changes for 10-day exposure quarantine affect facility-wide testing for an outbreak?
I don't see a relationship there at all, so I'm not understanding the question. If you want to talk further, shoot me an email. We can talk about it.
If an employee is in quarantine, can they be COVID tested in nursing home on day 5 so that they can return to work after day 7 in our nursing homes or assisted living?
Okay, repeat that, please, Blake.
If an employee is in quarantine, can they be COVID tested in the nursing home on day 5 so that they can return to work after day 7 in our nursing home or assisted living?
Well, if you have someone who's, all right, remember that this is just for people who've been exposed. This isn't for people who, and we're talking about a high-risk exposure. We're not talking about someone who was exposed to a resident and was wearing full PPE. This is someone who's had close contact. And remember, there is a CDC website that defines the risk levels for employees and what has occurred in terms of whether or not they're wearing PPE, etc. So this is just for close contacts, and healthcare professionals, I guess, as long as it's been a real close contact, I would think that they could use that. But again, we have to go back to and figure out what the state's going to say and what CMS says about that. before you change it. Also remember, to be honest with you, I was a little concerned about the risk numbers. I mean, you still have a 1 to 10% risk of someone being contagious after day 10. And if tested after day 7, I think it was 5 to 12%. So to be honest with you, those numbers are a little disconcerting to me. But MDHHS has jumped onto that bandwagon. We'll have to see what the surveyors and CMS say.
All right, it looks like that was the last question, so we can go ahead and move on.
Okay, we just have a few more slides and topics here. This is technically for nursing homes, but HFAs and AFCs should probably pay attention a little bit here because eventually this is probably going to come to you as well. The department finally has released a directive that requires nursing home surveyors to be tested prior to entering facilities. And we consider this an advocacy success. We've actually had private phone calls with Robert Gordon over this issue and the appropriateness of surveyors entering facilities untested. So this new guidance is effective now until May 1. There are some pieces in here that I found confusing though. So the idea is that facilities will conduct point of care testing and will be reimbursed by the state. And it just occurred to me that looking at the numbers that you all provided earlier, this might be a bit of a problem because they anticipate the use of point of care tests here. So each nursing home surveyor is going to have to show a proof of a negative result within the past 7 days before entering the facility. So obviously, every facility doesn't have to test them, but at least one of those facilities have to test them within 7 days, and they have to show that proof. If the facility cannot provide testing, the surveyor must use a community source or another nursing facility to get that done. And there's a complicating factor when we get to the next slide to that comment right there. The guidance states, and this was very confusing to me, we have a question into the state about this. The guidance states that if using an alternative source, in other words, the community source or another nursing facility, it must be within 72 hours. I don't know why that is, but then it's good for the next 7 days. And that is confusing to me. And we have a question out again to the department about that. And for those surveyors who may have been COVID positive and are recovering, they have to show proof of that, and then obviously they don't have to be tested for 90 days. So here are the exceptions. If they're responding to an immediate jeopardy issue or some other facility emergency, they don't have to be tested in advance. Another exception, and this is the point that I'm still not sure I understand 100%, is that if a point of care test is not available, that's an exception. So if they can't find a point of care test, I think this is what this is saying, in your facility for testing, at a community site or another nursing home, they don't have to be tested. So in other words, PCR testing isn't included here. I think that means that if no matter who conducts the test, if the results are not immediately available, they don't have to be tested prior to entering the facility. So this could be a challenge if you're not doing point of care testing. We are seeking clarification about this piece as well. Part of Laura's concern, remember that this came from the MDHHS, but Laura had input into it, is that they don't want to delay unnecessarily any on-site visits, especially any immediate jeopardy related visits. And whether testing is done or not, all surveyors, just like everybody else, have to be screened on entering as usual. The thing that's important here is that the department intends to eventually extend this to the licensing consultants for HFAs and AFCs, but they said that they're starting with nursing homes for now because nursing homes have more experience with testing. So we don't know how long it'll take to get to those other settings, but that is in the plan at least. We're including a brief care and recovery center and COVID relief facility update. There are now 12 approved care and recovery centers that are up and running. We have listed them on the next slide that's following this one. 2 additional are under reconsideration after an initial denial, and they put together some corrective actions. And there are 8 more under current evaluation. The department notes that there are still no applications for Region 5, and they finally have an application from the Upper Peninsula. They also told us that overall they see fewer applications from Western Michigan. In regard to COVID relief facilities, there are currently about 350 applications, and again, about 2/3, just like our members, intend to retain only. The department continues to suggest that you try to apply if you want to be designated as a COVID relief facility, but you can't meet the criteria. Some of our members tried to do that, and they were disapproved in the middle of the survey monkey form as soon as they identified that they couldn't provide dedicated staff. So the department can see when that happens. In other words, when you get disapproved, they have that document. They do want to encourage everyone to continue to apply, even though the application itself will shut you down at a certain part, because they are getting that data for future thinking as well. This is the current CRC list, just for your information. You can also note that there are no regional hubs on our list. They have finally all been taken down. So we're going to end today with some of our most recent outstanding issues, and some of them I've talked about today. Vaccine priorities for all levels of residential living. We want to know more about that. One of the things that I identified yesterday was that, and this kind of came up with the point of care positive test discussion that we had earlier, the point of care test discussion at least. The CDC guidance pretty much says if you are in an area of high transmission, that you really, if you have a positive test, you should consider it a positive test. But the department's Binax Now guidance says that you should follow any point of care test pretty much, unless you're symptomatic, with a PCR test. But it only says that in the Binax Now guidance. It doesn't say that for other point of care tests. And actually, it concerns us a bit because if a point of care test is positive, the number of false positives, and there are point of care false positives, but the number's fairly limited, and we are concerned about the idea that there's a lot of false positives out there, and the fact that a follow-up negative test means that it was a false positive. That's not necessarily true. But there's also the issue that if someone does have a false positive, you don't want to put them in the category of not being tested for the next 90 days as well. So there are some issues around this, and we have questions out to the state, since their guidance varies from CDC about this. We have asked them about the use of asymptomatic COVID positive staff in dedicated units. We all know that that's a crisis strategy under the CDC guidance. Their take on this is absolutely not for right now. However, they are looking at this as the staffing issues and the challenges with staffing continue. The department is looking at it, but for right now, you cannot use asymptomatic positive staff in dedicated units or anywhere. A question about whether or not the staff testing will change as vaccination progresses. That's one of the vaccination-related questions we have out there that we've not received a response yet. And this is one of the reasons, the next issue is why we asked the N95 question. So way back when, originally, at the beginning of the pandemic, the department pretty much said you don't need N95s for anything but aerosol generating procedures. And then in August, they come out and said you need N95s for everything. And the CDC recommends N95s for obviously persons in observation and positive people. And I think at one point they recommended it for areas of high transmission as well. So that's where we kind of left this, but now we're finding that Laura is stating that N95s are only absolutely needed for the scenarios in their recent surveyor guidance, which really means whenever there's been someone in observation, someone who's been exposed or during an outbreak, or obviously a COVID positive person, that except for those scenarios, it's not required. But that MDHHS guidance is still out there from August saying that N95s are needed for pretty much all care in all settings, nursing homes, homes for the aged, and AFCs. So we're seeking guidance for that, and actually we had to send them the guidance that said that. I don't think they were even aware that it was still out there, so this might be changing. We continue to argue for end-of-life visits for COVID-positive persons and those in observation. However, COVID-positive persons and anyone in observation are not allowed a visitation by anyone except for medical practitioners, etc. I alluded to this earlier. We are involved in discussions about options for COVID-positive persons at AFCs and HFAs. There might be some guidance coming out soon. We're not sure what we think about that yet. So that's kind of where we are. There's an awful lot of discussion, also awful lot of issues out there still out, and we know that. So I think that finishes it for today, at least the content that we have. Any final questions or comments?
All right, we do just have a couple questions, so I'll just get into those. A related question to ask Laura and MDHHS is if we still need to quarantine a resident after a hospitalization or a new admission for 14 days, or can it be 7 days with a test? Thank you.
It's a good question, and that again would have to go back depending on whether you're a nursing home or HFA. Did they say HFA or AFC? Blake, I missed that if they did.
They did not.
Okay, so if it's a nursing home, we're going to have to rely on CMS guidance. And we're not sure how this is going to apply to long-term care residential settings, again, as we said before, so we'll look into that.
Does the change to the guidance about 14-day quarantine affect the amount of days we have residents in new admission PUI status?
That's the same question I just answered.
Okay. MDHHS sent out a letter that they will accept the 10 days without a test, but not the 7 days with a test right now.
Oh, okay. All right, good. We haven't seen that yet. That's helpful.
All right. So as of right now, that actually looks like the last question. So as always, if you do think of something after the webinar has concluded, feel free to shoot an email over to Dalton, Deanna, or safeandcalm@leadingagemi.org, and we will make sure to get that answered for you as soon as we can. Again, another quick reminder of our Serving with Grace event. If you would like to register for that, just head over to leadingagemi.org. There will be the Serving with Grace banner that pops up. So you can go ahead and click on that and register for the free event to celebrate all of our members and award winners and everything. We would really like it if you guys would come. So with that, I guess another reminder, we will not be holding the Safe and Calm webinar this Wednesday or this upcoming Wednesday, as we will be having the Serving with Grace event. So our next Safe and Calm webinar will be Friday, December 11th at 11 a.m. Eastern Standard Time. So with that, we would like to thank Dalton and Deanna, and we would also like to thank our 75 members and participants that took time out of their busy schedules to join us for today's webinar. We appreciate everything you guys do each and every day to support your staff and provide quality care to your residents. We are grateful for your continued support, and we are here for you when you need our assistance and resources. With that, I hope everyone has a great remainder of their Friday and has a great weekend. Stay safe, and we will see you guys hopefully at our Serving with Grace event on Wednesday. Thank you.
Thanks, everyone. Have a good weekend.
Have a good weekend, everyone.